Around 65% of world's population is workers. The ILO estimates that some 2.7 million people around the world succumb to work-related accidents or diseases every year, which causes 7,500 deaths. That is 5 to 7% of total deaths every single day. There are around 340 million occupational accidents and 160 million victims of work-related illnesses annually. The annual report World Day for Safety and Health at Work on 28th of April calls attention to the magnitude of problems faced by the workers across the world. The COVID-19 pandemic has posed an unprecedented global challenge for safety and health at work. Many enterprises provide a work-from-home option to limit the spread of virus, and business continuity provides work flexibility. But it poses an ergonomic, psychological and health risk. Several employees struggle with presenteeism, the blurring of lines between work and private life. As workers are confined to their homes and there has been a surge in domestic violence. 5 times more calls were made to domestic helpline numbers. UN Women 2020. WHO reports that
many health and care workers are working long hours with heavier workloads and insufficient time for rest and recuperation, resulting in chronic fatigue. At the same time, they are coping with the fear of contracting the disease and spreading it to their families and others. In addition, incidents of violence and harassment against health workers have increased during the pandemic, as well as stigmatization and discrimination.
COVID-19 had overwhelming impact on the world of work. Unmanageable spread and the threat of contracting the virus led to immediate closure of businesses and schools, widespread loss of jobs in crucial sectors, restrictions on mobility and distress on global supply. Chains and markets, informal workers and enterprises were most affected due to pandemic. The full or partial lockdown measures implemented in many countries affected some 5 billion people globally and had several detrimental effects on about 1.6 billion informal workers, with women being the most hard hit. India has seen an exodus of migrant workers at the time of lockdown and millions were pushed into poverty. Protecting informal workers is the most challenging aspect of such situation. Universal health coverage, social security and healthy work environment for every worker are the measures for attaining sustainable occupational health and safety goals. Steps can be taken in this challenging time to protect and safeguard workers. Legislations need to adapt proactively to new challenges. Creating new laws and regulations to specifically deter violence and harassment of frontline workers and protocol to return to work safely are necessary for COVID-19 hazards. COVID-19 should be considered an occupational injury for frontline workers and benefits should be provided to those who are affected in various ways. Raising awareness among employees, providing special transport services, conducting mental health assessments, and providing assistance, ensuring protected paid sick leaves or allowance for quarantine, or when a dependent child or another member of their immediate family who needs their care, and providing ergonomically sound working environments can make it better for workers in the time of pandemic.